Hi, this is Mayor Joe Ganim. Just taking a moment in the midst of all that's going on in this health crisis to thank those that didn't know they were going to be a part of it, but ended up being there for all of us as our first responders, our healthcare workers, our 911 dispatch, police, fire, ambulance, and even those that are working in the grocery stores and in the pharmacies, our transportation workers that are driving the buses so those that are going to work or to the doctor or to the hospital can get there. Our public facilities that are picking up the trash for us and keeping our streets clean. Let's thank them all. They're there for us. We're in this together.
Thank you.
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 We'll get through this together. Thanks for your continued support.
So thanks. Welcome. It's May 6th, 2020. It's a little after 12:30, and it's virtual town hall. Compliments of, I guess, City of Bridgeport and your Mayor Joe Ganim. Nice to join you, have you join me on 6 de Mayo, I guess it is, right? Share this on Facebook, click share now, and we want to bring you up to date. We mentioned this yesterday. Masks, PPE for regular folks like us, not the high quality N95 masks, which are reserved predominantly for our healthcare workers and first responders. We're going to be distributing, the City of Bridgeport will be distributing tens of thousands, they're using the number 100,000, we'll see what happens, of masks to Bridgeport residents. City residents are required to have some type of proof so that we don't get into this, people driving in from out of town, and no disrespect to people driving in from out of town. But we only have enough right now. We will provide them to people who are residents of Bridgeport, who have vehicle registrations, utility bills, driver's license, something to show that you have that connectivity to being a resident of the city. We want to get masks out to everyone. It is part of our reopening plan, which we'll talk about in a while. It's part of staying safe. The stay home, stay safe. When you can't be home and you need to stay safe and you go places, you need to wear them. Some of the calls we got earlier today on WICC was, Mayor, I was in a grocery store and they weren't wearing masks. What do we do? Well, you can't get in a fist fight over it. But the grocery stores are asked, and they are supposed to enforce that for their customers and for their employees and for the common well-being of the population in general. We are there as a support mechanism. And we will respond if required, but people need to wear masks, so that's why we're providing them. I think we're one of the first cities in the country. My good friend, the mayor of Los Angeles, is giving out 10 million masks, Mayor Garcetti. He's setting the trend on that. We want to follow, we lead, follow, or do what's right. However we get there in line, this is one of those things that is good. Another thing that I think is good that we have an answer on it, schools. Schools are closed for the rest of the academic year. If I need to, I'll say it again slowly. Schools are closed for the rest of the academic year. That is in classroom schools. There is still remote learning, and that will continue. And we had some calls this morning as well about graduation classes or how that's going to be done. And I know the governor and others have talked about ways in which we might be able to improvise, maybe out in football fields and so on. So I'm with you as far as seniors from our high schools. If you consider the 8th grade a graduation of high school, anybody that's graduating, and this happens to be that year, it'll be memorable for what you weren't able to have as far as your graduation ceremony, and for that we're seriously and deeply sorry. But you're graduating. You're going to turn the corner. I would do everything except for the ceremony as you'd love to do it, and prepare for that moment with you, your family, and classmates, and look forward to the education that you have to apply it, whether it's on to higher learning, which I encourage, whether it's for job opportunities. And if you have the opportunity for higher learning right now, it may be a better course if jobs are tight. And if we can help create that opportunity out of Bridgeport, we want to do that. We're hoping to put a thing in place called Bridgeport Promise. And I'll leave that with ... for discussions as we talk about that, creating opportunity for Bridgeport graduates to go on and have financial accessibility to higher education in either state or public universities. On the school stuff, we got up on the board, it says, call the superintendent. He's a wonderful man. His number is 203-275-1001. And that is for parents and students who have a question or a need connected to school teacher or school principal. We are working remotely. The best way to connect with the appropriate Bridgeport Public School person or assistant is to reach out to the superintendent's office. He can appropriately, as he describes it, direct parents and students to get the answers that you need, that we need, to continue to make sure that we're, smooth or bump or problem-free on the balance of the school year, which, as I've said, declared by the state of Connecticut, collectively by the governor, is remote, not just in the city of Bridgeport, but everywhere. Speaking of school, I got someone raising their hand on my right-hand side.
Mm-hmm.
Yes, Ms. White?
The people,
The people?
the Facebook follower people would like to know the locations,
For masks?
yes.
Okay, so those that can listen, and it's really written appropriately here, some might say small, but I think appropriately, because I want to compliment those who put the effort in to do it. They'll be at the following locations, and we'll put this out every day between now and Saturday, and if we're able to give them out before Saturday, which I would like to see, we'll let you know that. But for right now, it's Saturday at 10 a.m. They're thinking 10 to 2. Let's see how it goes. Bass Pro, Seaside Park, I would think that'd be under the arches or at the arches. Hopefully traffic won't be that bad, but it's the morning on Saturday, so that's not usually when the parks get filled or people want to go down there, even though they're closed. Harding High School and Fairchild Wheeler High School. So they're spread out kind of in points throughout the city, if you think about that. We could show them to you on a map maybe later in the week so that you can actually see where they are. You probably know where Bass Pro is. You probably know where Seaside is. Central High School, Harding. If you go to Harding, you may not know where Central is. Who knows? You may not know where Fairchild is because it's kind of been incorporated into Bridgeport from Trumbull, but it's kind of way up there. But these are going to be the distribution points for masks, up to tens of thousands, up to 100,000 masks to Bridgeport residents, starting Saturday at 10 a.m. Thanks so much for bringing me up to speed, Ms. White, and for raising your hand to be acknowledged. SNAP, how do I do that? SNAP, it's kind of cool, but it's Emergency Supplemental, S, Nutrition, N, Assistance, A, Program, P, Benefits. If you receive the SNAP program, all households will now receive the maximum benefits allowed. So this is good news from the federal government. And I was talking to Senator Blumenthal and Senator Murphy and our Congressman Jim Himes, and I want to thank them and all of the Connecticut delegation, regardless of stepping up for us with this. The emergency benefits amount to a household that will see EBT, which is the card you get on Friday, May 8th, is $150. So whatever you would get, if you're getting 80, 90, 120, it'll be $150 now on Friday, May 8th. That's this Friday for emergency benefits. Okay, I think that's good news, and again, our thanks to our partners on a federal level and those that distribute them here on a local level to so many people. So we are, maybe contrary to what some people might think, we are planning, meaning putting in place plans to reopen, and we do intend on reopening, and it's a necessary thing. And we've had discussions about when, where, and how. Here are the bullet points. The neon lights are centered on May 20th, May 20th, May 20th, part of a 4-stage reopening plan as outlined statewide. And I would dare say it's really a multi-state approach in the Northeast. Our state in New York and New Jersey, and I think Massachusetts, Pennsylvania, Rhode Island, among others, are collaborating, working together, putting their best or our best brains forward. And that doesn't mean the elected officials necessarily, somewhat in a way we're conduits or we're passers through on what is the best information that we get, but we have to apply it to the services and the authorities that we have to implement best practices from the medical experts. So here's what it is. We're stating it every day, even though it's redundant, bear with me, but some people are getting it every day. We should back up one slide so I get it right. To start the phase in, the state must meet, the state they're talking about, and we're going to look at Fairfield County and Bridgeport, a 14-day decline in hospitalizations. I want to talk about that in a minute when we get to the slides. But there are 6 other points of criteria. Criteria is as follows. We know what the word criteria means, and they're going to put it up on the board in a second for me so I can talk about it. Increased testing availability, and I will tell you in Bridgeport, we have done that substantially. We've had the help of our private partners, and we'll talk about those testing sites around the city. But it's easier to get tested now, and the testing goes on, and we need that. We need that for a metric, for a data point, to see where we are with people that are infected. And we try and share with you the best information we have every day, and we'll do that in a minute. Contact tracing is still the one I frankly know the least about. I do know we've put a team in place, meaning the state of Connecticut has put a tracing team in place to try and work through this. And it's likely going to be, if you raise your hand and you've been infected or you've been tested as positive, they'll go back and try and figure out who you were in contact with and try to utilize that information to minimize the spread or exposure to others. Of course, we're going to continue, which we've done from the beginning, and I don't mean just us, but I will say us, meaning the city of Bridgeport. We close senior centers, protect high-risk populations everywhere, people with pre-existing conditions, generally people who are elder. I don't know how they're defining elder anymore, if it's over 50, over 60, but let's just figure it out that age works against you in this, so be safe. The older you are, I would say use even more precautions. Adequate healthcare capacity, we track that on a daily basis. We are doing well on that. We'll share that with you, not just only in Bridgeport. We'll share that with you in Fairfield County and a little bit statewide as well. Adequate PPE, that's one of the programs we're putting in place to distribute up to 100,000 masks in our city. I hope other cities and towns will do the same thing to help ensure adequate PPE, personal protective equipment, and appropriate physical distancing regulations that are in place now will stay. 6 feet or more. 6 feet or more, and there's challenges with that, with dining and restaurants and with hair and nail salons as it brought to our attention. So we will be working with all of the great minds in the healthcare and understanding what this is and how we should make our best protections and implement them in our reopening. So we have restaurants, a popular topic and kind of the one I take the kind of the personal privilege on, the kind of, drop the face and say, how do you feel about it? I'm excited, personally excited to a certain extent about outdoor dining, restaurants, no bars. Anticipated date is May 20th. And I want you to know, city officials are working on a plan to expedite processing and relaxing guidelines to allow restaurants opportunities to open under the state guidelines. So what does that mean? Predominantly, and probably most importantly, it may even involve zoning changes. But we've been looking to do this for a while. What does that mean? It means that we want people to have the accessibility. We want restaurants to be able to have dining outside on sidewalks. Pocket dining, where 1 or 2 possible parking spots on a street, if there's not enough sidewalk space, could be utilized for tables and chairs like other communities do. I think it's cool. You put planters there and you block off the space. And it becomes kind of cool space right out in the street. It reminds you of kind of what Paris and Europe, but it'll be Bridgeport. New Haven does some of it. I know other cities are looking at doing it. And so that's what we're working on now. We had a conference call on it yesterday. We weren't able to complete the conference call or the process, but our zoning, our economic development office, our communications office, and the mayor's office are working on this. If you are a restaurant owner, you know one, or you want one to make sure that they're open, let them know that there are forms that they need to file with us. Who's us? The city government. And that's it. It's like this. This is the notice we got. I showed you this yesterday. It says guidance, statement on outdoor services of alcoholic beverages and patio, extension of use, and or additional consumer bar applications. So they need to move forward with this, and we're going to do everything we can to expedite and to make allocations or allowances for restaurants to begin, because this is the first kind of step. It's going to be outdoor dining because it creates the least amount of health risk. Now you got weather, you're going to need umbrellas, it's going to be cold, you don't have space. I get it. But we are going to make do, and we're going to forge ahead and begin the process of opening dining, outdoor dining. And then we'll look at, as I understand the protocol, we'll look at what percentage, maybe it's 25% of the capacity of a restaurant will be allowed inside, and there'll be other protocols that will be announced on that. But we want you to know that we are moving ahead. Discussion. Okay, let's have discussion, even though it's a little bit one-sided, bear with me. Some say, oh, May 20th is too early, or it's too late, or why don't you go to June 20th? My view is this. We have begun the process, the state has begun the process, and there's no better time to open. I don't think a delay changes the dynamics. I think if we meet the metrics, that we go with May 20th. We do it cautiously, as we've done, and we do it with health as a priority, or we're making mistakes. But to let it delay, some people said push it back, because what more are we going to do? If the numbers indicate, as it is, and if you follow New York is now ahead of the country on the decline. I think we're, especially in Fairfield County, following that trend, just as we talked about. Not that we're smart, we're just it's kind of simple to figure out. If we're going to get it first, if we do it right, and we flatten the curve, we're going to be following kind of the epicenter in New York. So we're there. At least in Fairfield County, I think we've made some great strides due to efforts. So that's where we're going. So my next slide shows me, so that's openings of restaurants. You'll hear about nail salons and beauty parlors and hair cutting. Those will all be on May 20th as well, and that list will be added to as you go along. I heard somebody ask about tattoo parlors, but I don't have any answers on where that fits into the statewide plan, which we'll follow. We'll be announcing later provisions that we're going to make in city government. We are in the process, even between now and May 20th, of opening up more city government offices. As people are tested, they'll be allowed to come in with protocol. The building's not going to fill up to capacity as it was before, at least not now with present plans, but it will come in with staggered shifts. It will come in with the facial coverings, likely with gloves, with the glass partitions that we show you every day in one of our slides, and with protocols on how people work together in a smaller space, or preferably how we make sure that they are not on top of each other. If you have a want or need or are just bored, you can go to bridgeportct.gov directory. That is the city's webpage. And if you watch it at 2 in the morning, sometimes it gets updated even that late at night, which is kind of cool. Here's our test numbers. Our hospitals, our 2 main hospitals that are doing testing, those are the numbers we're sharing with you. They're doing about 200 a day, which is the way we kind of like phrase it out. They're up to 6,846 tests, up another 200. We also have other testing sites, as you know, on Albion Street going on today, and some of the other health clinics. We haven't incorporated those numbers in, and we may or may not, but as I go through, I'll kind of explain to you why I think that we don't want to get too caught up on the testing numbers alone as we pivot to the criteria numbers that will help us give an understanding as to where we are for reopening. That's going to be more hospital capacity, hospital discharge rates. On hospital capacity, compliments again, they've done a phenomenal job. They're hovering at that 55% bed capacity, and we see the ventilator availability is pretty good, stronger than that. It's in the 60, 61, 62%. Those are good numbers, especially good numbers at this point or this stage in the pandemic, where we believe that the apex or the top of this thing, we've kind of rung the bell on that. Doesn't mean it can't go back up, but the numbers we're seeing now, as they go against our capacity, the numbers of individuals versus number of capacity, is at a good ratio or good with raw numbers. That means they have almost 500, maybe 400 and something, almost 500 beds available. Now, granted, these are COVID, and that means they've still pushed aside other important medical, what do they call them, non-essential hospital procedures and operations and things like that. So we're not where we want to be yet, but we are where we need to be at the moment. Before I get into these numbers, you have Eddie. That's from the Turkish place. He's trying to get his business open too. I know that. He's on Markle Court. Maybe he can set up. The tables on the sidewalks there too. PT Pastor, appreciate it. Madam Wanda G would love to get you back in front of City Hall, making sure that people come in under the right protocol soon. Catherine, KK, Vicky, Ashley, Lucky Jennifer. Okay. And is that Nadine? Yes. Appreciate it too. And Juan, appreciate you joining. So this is some important information. I don't expect you to kind of have to care about it from day to day, but understand why this is important as we make decisions to reopen, because that affects your lives. School closings may affect your lives. City closures affect your lives. So that's why I want to keep you up to date on it, but this will as well. So what's happening, I think, and we're going to incorporate a new slide today or two about hospitalizations. And generally across the board, hospitalizations have come down, and we'll show you that. It just figures that the day I want to start this, hospitalizations are up. So what this shows is the state of Connecticut, and it has it by county. And it shows patients, that's individuals, currently hospitalized by county, in other words, Connecticut. And if you see the slide, it has Fairfield County, New Haven County, and the color codes, the darker they are, means more people. But really what we're looking at now, since we know the people population versus the hospital beds, is generally good. Certainly in Fairfield County, and I would dare say across Connecticut. New Haven's a little bit more challenged maybe because their numbers are higher, but they're doing well. Is that how many people have, and this is the way I'm going to describe it, and I think this is right. It's hospitalizations in Fairfield County are up by 12 people. So it's up to 519 from whatever it was, 507 yesterday. And New Haven's up by 17, up to 504. And so what does that tell you on the slides is that those are up. And the governor was asked about this, I read this in the press yesterday, and it's one day. So we're not going to go and change course over this one day. It could be for a variety of reasons that we can't identify. Frankly, in my view, I think it is for a variety of reasons that we can't identify. But let's go on to the other charts and tell you what we do know that I think are important. Go back to the lead-in chart. Number of people directly impacted. And we're going to look at the next. Is the next chart shows us that? Well, they're in order, but I wanted to save the hospital discharges. So these are the number of people. These are charts we always show. Confirmed COVID persons in Connecticut. In Fairfield County, we're at 12,360 with 519 hospitalizations, and 935 people have died in Fairfield County. That goes against the state numbers. State numbers, you got 12,360 in Fairfield County. You got 30,621 statewide. You've got 1,500 hospitalizations, so we've got a third of the hospitalizations, a little more than a third of the confirmed cases, and about a third of the deaths, with 2,633 people statewide have died of corona or related illnesses. Next slide shows, again, this is pretty much what we track on our other slides, which is confirmed cases. And it goes up, but not at a challenging trajectory that is of concern. So let's go to the next slide. This is of somewhat a tough slide to understand. It shows number of deaths per day in Fairfield County related to as a result of COVID. So what you would think is, as you go through some of the other slides and you see number of hospitalizations generally going down, which I'll show you in a couple minutes, is that we've had this kind of erratic reporting of people that have died either of COVID or COVID-related illnesses. So it's kind of up and down and all over the place. We talked about this, and we can't really make heads or tails of it to give you useful information, but we thought we should share it as information nonetheless. Just because it didn't reinforce a trend or anything like that doesn't mean it's not information that we thought we'd share. And because it involves deaths, we thought it was particularly important and a critical chart to show you. So what I think you see here is ups and downs, certainly. The numbers are not so statistically, when you look at charts, you look at certainly the trends, but raw numbers, and a small number when you have not a lot of individuals. For instance, if you're talking about the first day of this, if you had 5 people, and then it goes to 2 people, it looks like a huge differential on a chart when it's really only 3 people. Not only 3 people, every person is important. But then when it goes up to 80, you see it looks like it's off the chart. Oh my God, what happened that day? What was it? Something go on. So it's hard to judge from this, and it's hard to get a good takeaway from this. Other than that, we don't have a handle on why. Some of it could be, and I don't mean deaths or data, but data dumps. We saw things with the nursing homes. We've seen where people have not been identified as COVID-related deaths, and then later on, it was determined that the experts may put them in these categories. So there's a lot of reasons why we don't know, but I thought I'd share it with you anyways. Now I want to go to some of the charts that I think do tell us something that are helpful. This one is one that we wanted to pull together. I've talked about it for the last few days. If it's a metric that, if you go back to the criteria, flip back if you could, remember the governor's criteria of reduced, I think they said discharge rates. So it was testing, sufficient tracing, protecting high-risk populations, adequate healthcare capacity, adequate PPE, appropriate distancing. Go to the earlier one, which said 14-day decline in hospitalizations, in addition to those 6 points. So here's what we were able to extrapolate, and if we find out that we can get better information, we will. This is hospitalizations rates, and the best I can do is this is not the discharge rate. I felt that the discharge rate, and frankly, the statistics that are provided by the state don't have carved out discharge rates, nor do the hospitals provide them to us on a daily basis. This, I believe, is a net number of people that have gone into the hospital on a particular day. Each one of these dots is a date and shows the number, as well as the people that were discharged. So it's a net number. And I think that's much more telling and a much more useful tool than just saying, and maybe what they mean is in discharge rates. Maybe the governor's criteria for 14-day discharge rates, I would believe, includes these numbers. Why? Because if you discharge 100 people, which is great on one day, but the same day 200 people come in, your net number is probably more important than that discharge rate of 100. You've got a net increase of hospitalizations of 100. If 200 go in one day and 100 come out, right? So the net number is what I think is shown on the earlier map. Let's go back to that for a minute, which actually shows the only day that I think we've seen an increase. I think it's slide 14. No, slide 16. So these numbers, I think the New Haven and Bridgeport numbers, which I quoted, was 504 for New Haven, 519 for Fairfield County, which is up 12, is a net number. So you might have had, and I don't know the two numbers. You might have had 50 people discharged and 60, and let's see, it'd be 112 people go in. Anyways, your net number, or 62 people go in. So your net number would be a plus 12. So now back to what I think is a useful chart, which was the one we were on, which was, yes, shows the graph. So each of those data points shows your net hospitalizations. So that would include the number of discharge and the people that came in. So what do you see? Even though it's dark on dark, it's dark blue on a black chart, which is okay. Maybe we'll get a white chart for tomorrow so you can see it better. Is each of these, you see a curve go up, and then that's around, which we talked about before, which was April 14th, 15th, 16th in there. And then it starts to drop off, kind of steps going down. It's not just a straight shot down, but steps. And then going up a little bit, coming down, 3-4 days in a row, 3-4 days in a row, going down, down, down. And you're down to that 500, roughly 500 number for Fairfield County that we talked about. I think it was 512. It was as high as 800 at one point, these hospitalization rates. And so if you're down to 500, we're showing that decline. I don't know if you could see a clear 14-day because you had a couple days that peak up, but I think we'll talk to state officials about what that means and how we kind of further define it. I think this is a better chart. I think netting out your what do you call it when you go into a hospital, your admissions versus your discharge, and then getting this number is a much better barometer of where we want to go for our criteria for reopening. And what's most important on this, in my view, is overall hospital capacity. And let's stay with Fairfield County for a minute. So you know from our earlier chart, and we don't have to go back there, that we've got almost 1,000 beds, a certain number of ventilators, but 1,000 beds just in Bridgeport alone, between Bridgeport and St. Vincent's, or the Yale family and the Hartford Healthcare family. You've got 1,000 almost. And in Fairfield County, we're going to add up the beds for you so that you know. I don't have them off the top of my head, but you've got Norwalk Hospital. You've got Stanford Hospital. You've got, assuming it includes Danbury, which is Fairfield County, and Greenwich Hospital, those that I know off the top of my head, you've got to have another 1,000 beds. So if you go back to that chart, actually it's still up there, even at our peak, which was the middle of April, you were only at 800 beds being occupied. Now again, this is just COVID. But if you assume you got over 2,000 beds, and we'll have that number for you tomorrow. I'm sorry, I'm just kind of winging it on the overall bed numbers, but it doesn't really matter. You've got to have at least 2,000. If we've got 1,000, close to 1,000 in Bridgeport. And now we're down to 500 on this of 2,000 or more. It's probably closer to 3,000, but we'll have that number for you. We're in a safe zone. And as those numbers, if they continue to be anywhere near the numbers we have now, whether they plateau at this number or drop, even arguing if they went up, although that would not be a good sign, we're in a good place in Fairfield County. And that supports the proposition that we're over the hump and we're on our way towards cautiously, but I think appropriately, a reopening plan. And that's good news. And so that's why let's go to the rest of the charts real quick and then get to the reopening plan, because we're well over the 1 o'clock number here at 1:04. That's the time. So we've got 2,197 people in Bridgeport, again, active COVID cases that have accumulated. Doesn't mean they're all active now. It could have been their 14 days could be over and they could be clear. They could be in a position where they have the antibody now, so that they're actually arguably in a better position than someone who hasn't had it, because they say, and they're not sure, and nobody's sure about any of this stuff, that if you had it, chances are you're not going to get it again. We'll see, and we hope. But a lot of these 2,197 people, that's 17 up from yesterday, which is our lowest increase on the chart that you're familiar with. I'd love to have that one in front of me too. Shows that it's starting to plateau even on those numbers. Now, again, the reason I go back to the hospitalization rates as a better indicator is because this chart that we've been going with, and go with the next one, go with the small, shows a flattening. That's great. But I believe we're only using the same 2 points of testing, which is our hospitals, even though we've opened 5 or 6 others throughout the city. And as the increase in testing goes on, you got to assume the number of confirmed cases that we discover maybe is going to go up too. So I think that's why I think it's the best appropriate thing to look at for reopening is more testing, even if the numbers go up, which they didn't today. Even if they go up, if we add those other sites in, you want to know how many people are going in and coming out of the hospitals. How many people are going in and coming out? And of course you want to know the mortality or fatality rate. So let's, I got another question here.
Can you remind people that these are confirmed cases, not number of people who actively have coronavirus right at this moment?
Yeah, it's kind of hard to discuss that, but these are confirmed cases by testing. Okay.
And that it's a cumulative number. People are scared. They want to know why the number's so high.
Why the number's so high?
Yeah, because we're just adding on since day one.
Yeah, it's accumulation. You're right. This is 2,197 people since, go back to the earlier chart. I think there's total confirmed cases since we started, even before the beginning of March. And not to comfort anybody or scare anybody. 2,197 cases. I know, and you know, and we believe more testing is going to show more cases. There's more than 2,000 people in and around Bridgeport, a population of north of 150,000 people. What is that? It's 1% of 100. It's a very small percentage. Doesn't mean we should get a comfort level. Oh, it's only 1 out of every 100 or 1,000 people that we contact could possibly have this. That's not the way to look at it. But it's not to scare you. I don't think these numbers. Again, I don't want to lull into a false sense of security, because this thing could spread, and we've seen it spread like wildfire throughout the world. But the precautions that we've taken, that you've taken, whether you're listening here or not, throughout the city and beyond, have had an impact on reducing and eliminating the spread to the pandemic of a portion that would overflow or exceed our hospital capacity, and has minimized the number of people that have claimed by this, or lives that have been claimed by. Okay, next chart. You see us crossing. I love to see these days crossed off. So you got 2 weeks left till we hit May 20th. And that'll be as they used to celebrate Cinco de Mayo on May 5th, is going to be Cinco Bente de Mayo, right? Bente de Mayo, ¿sí? Comprende? Yeah, that's good. Okay. And also, we understand, comprende, this artwork by Tamina, Central High School student. This is cool too. We had the lion yesterday. I think these are sunbursts. Students were given a symbol that depicted different activities. They were to track their activities and organize the symbols to create a piece of artwork. And we have that. Pretty cool. Again, always admire someone who can do something I can't, and you can draw. You're an artist. You're creative. Hats off to you and to Central High School and all of our students. If you want to get a hotspot, chase a bus down. Remember they used to have don't chase a bus down. We have free hotspots at the Sheen Center. There'll be a bus there that provides a free mobile Wi-Fi hotspot to you, as well as at Central High School in the parking lot and Bassick High School. If these are of help to you, we appreciate those that are putting them out there. Also, the McGivney Center.
City Lighthouse is a supporter.
This is done by the Bridgeport City Lighthouse Program, which is the after-school program, which is engaged and will be engaged this afternoon with other mayors and communities about summer youth programs around the country and how Bridgeport is going to learn from and share our best practices so that we can have summer youth activity this summer. Speaking of activity, we got leaves that are picked up. Brown bags are not picked up. If they're not picked up, call Public Facilities. We want to pick up your brown bag and the leaves in it. We really don't care about the bag. We care about the leaves, and you want to get rid of them. I've driven around, see them sitting on the side of the road. Public Facilities is on it. 203-576-7130. For our radio listeners, 203-576-7130. If you have brown bags, why don't you call? Okay, this is Community Mobile Food Pantries tomorrow. Thank you to all who volunteered, donate, and support. If you are in need, the slide should say, so my apologies. No questions asked. Getting added right now. See how efficient this operation is? All except for me. If you are in need, no questions asked. Go to the next slide. Drive-through mobile food pantry tomorrow, 9:30 a.m. Connecticut Food Bank, 9:30 a.m. to 2. That's at the Bass Pro Shop, the same place we'll be giving out masks on Saturday. You know where the Bass Pro Shop is? In the parking lot. Drive up only. Volunteers put groceries in your trunk for you. No questions asked, no answers needed. Supported by Bridgeport City Council. Great job, Bridgeport Police Department. Great job, Bridgeport Police Department, Fire Department, EOC, Bridgeport Regional Business Council, Bass Pro, and volunteers. Give a shout out to you. Thank you so much for providing food to people that need it. Don't be ashamed if you need food. This is one of those things that are no one's fault. We're going through a worldwide pandemic, and I would dare say that in this country we should not have to worry about food. Community drive-by grocery giveaway, another great generous thing by Refuge Temple. Bishop Courtney Williams' leadership called me this morning. Groceries giveaways to the first 100 families, and that's in the North End at 3050 Main Street, and that's tomorrow, May 7th at 11 a.m. Bishop, thank you, and Refuge Temple for all you do. And again, this is generosity of people. That's Thursday, May 7th at 11 a.m. at 3050 Main Street. I'm assuming it's no questions asked. Places of worship in general. In Connecticut, here's what we need to know. We had a lot of questions about this, and we have limited authority, but we all want, look, it doesn't matter about authority, what people tell people to do. It's what we do. We got to do what's right. In Connecticut, we're waiting for the guidance from our state officials regarding the opening of churches, of houses of worship. Until then, this is what I understand. Limited gatherings to those who can be held virtually by remote viewing, and consider video streaming. And all I can say is that more information is forthcoming. We want to be consistent across the board. We don't want to discourage or be different. Tomorrow at 1 p.m. to recognize National Day of Prayer, please join us with a digital collective prayer service. Again, to support not only prayers for all of us, but to engage our religious community who does so much and is under their own pressure and stress from the failure to be able to gather, as is so important for worshiping. Town Hall, WICC Radio 600, thank you for producing us live, for bearing with me live and in person, and Radio Cumbre 1450, muchas gracias, 1450 AM for broadcasting us live and dealing with my lack of bilingual abilities, but we appreciate it that you're broadcasting to all those in Spanish. Thank you, National Nurses Week. That's May 6th to May 12th. We want to thank you, and through you to all healthcare workers for what you do, all frontline responders. That goes all the way to, as we noted, public works, grocery stores, sanitation workers, police and fire, EOC, but to our nurses, National Nurses Week. We love the nurses. We love the nurses. Yes. What else? Questions, answers, challenges, press calls. Because we're 1:13 and we got to let people go about their days. I know you're busy with the stay at home.
I'm concerned about right now, two things. The first thing is, you know, almost 3,000 people in Bridgeport confirmed, but we're opening up the state, you know, people are dying, blah, blah, blah. I think you need to explain one more time, but that's.
Yeah, that's a cumulative number. It doesn't minimize the loss of one person or the impact to any individuals. Critically important. Look, we're taking this as seriously as we can. I think the projections were and could be devastating. Any reopening that goes into place by the city of Bridgeport and certainly by the state of Connecticut and beyond is going to have safety first. I will tell you though, here's again, this is my 2 cents, and if it's worth 2 cents, take it. If not, I could be right, I could be wrong. It's a perspective. But we are, as you are living this every day, we're living it from the perspective of trying to make sure that we give out accurate information. Whether it's May 20th or June 20th, I think it's how we reopen as opposed to the date that we reopen. And everybody's working on this to get it right, and we'll make sure we do everything to get it right. What else you got?
Beaches,
Oh, beaches.
Opening on May 20th.
Yeah.
And they can't hear me.
Is that from-
So you have to repeat my question. Yeah.
They can't, it was a question from, about the beaches, right? Is that from Sons of Beaches? No? I thought that was an organization. All the people that like to use the beaches and the golf courses and all that, I'm hoping to have announcements. I don't want to just start with golf courses, although they're the easiest. They have kind of a test, they've been tested as far as the protocols because it's such big open space. We do have big parks that we can open. We will look at the protocol. The police department has laid out, and thanks to the leadership of the Bridgeport Police Department, has laid out a very detailed protocol that we're reviewing to apply to ensure whether it's reduced park capacities, whether it's Bridgeport only in many instances. St. Mary's is a challenge that we want to address safely and for the residents of the city of Bridgeport, and no disrespect to our surrounding towns. And we want to open the beaches as well. We still have lifeguards in the budget. So we are looking to do that with precautions. I don't know what it looks like, people on the beach going swimming with masks on. I'm making a joke because that's probably not what it is. But there has to be social distancing and protocols put in place. This is new for everyone. There's no playbook on my desk or on the governor's desk or anybody's as to how to do this. Hopefully, by learning, we will be smarter. And God forbid we have this or resurgence of this or similar. We'll have learned from it and put things in place. So we're going to do it. We're going to do it deliberately and we're going to do it cautiously. But we do need to move forward in a fashion soon towards the summer and the challenges that poses for us as a city and as a community, the park city that has tons of parks that people want to use. Anything else?
That's enough.
She said that's enough. Thanks. In this together. We'll see you tomorrow. Thank you again.